will talk about sedative and hypnotic. So what is sedative? Sedative are the drug which reduces excitement and calm the patient without inducing sleep. Whereas hypnotic are the drug which induces and maintains sleep. Both the drug produces dose dependency and depression, especially barbiturate. Barbiturate causes relief of anxiety, followed by disinhibition, then sedation, hypnosis, anesthesia, and ultimately causes coma and death. Come to classification of sedative and hypnotics. Sedative and hypnotics are classified into first group benzodiazepines. Benzodiazepines are further divided according to their duration of action. Short acting, intermediate acting, and long acting benzodiazepines. Short acting benzodiazepine includes triazolam, midazolam, and oxazepam. Intermediate acting benzodiazepine includes alprazolam, estazolam, lorazepam, temazepam, and nitrazepam. Long acting benzodiazepine includes diazepam, clonazepam, chlordiazepoxide, and flurazepam. Second group is barbiturates. Barbiturates are further divided according to their duration of action. Ultra short acting, and long acting barbiturates. Ultra short acting barbiturate includes thiopentol and methotrexate. Short acting barbiturate includes pentobarbital and amobarbitol. And long acting barbiturate includes phenobarbital and mefloquine. Next group is non-benzodiazepine hypnotics. It includes jet compound like zolpidem, zopiclone, S-zopiclone, and zolpidem. Next group is melatonin analogs. Melatonin analogs includes ramention and tessimention. Some liver drugs are also available like orexin receptor antagonists, which includes sevoroxant and lamborexant. Some miscellaneous drugs also used as sedative hypnotics like antihistaminic and some antipsychotic agents. Now come to mechanism of action of sedative and hypnotics. Normally, there is a balance between GABAergic and glutaminergic input in the brain. When this balance is swing in favor of GABA, which means if there is an increased concentration of GABA, which leads to relief of anxiety, sedation, and hypnosis. On the other hand, increase in glutaminergic level leads to restlessness and insomnia. Benzodiazepine and barbiturate both act on GABA A receptors. These GABA A receptors are linked with these chloride ion channels. When GABA is bind with these receptors, it opens the chloride ion channels, which leads to influx of chloride ion, which causes hyperpolarization, and decrease in membrane excitability. This GABA receptor has multiple binding sites. Benzodiazepine binds with this GABA receptor. It increases binding of GABA. It increases binding of GABA to GABA receptor and increases opening of these chloride ion channels. Benzodiazepine has GABA mimetic effect. Barbiturate also binds with these GABA receptors. It also facilitates binding of GABA to these GABA receptors. These barbiturate increases the duration of opening of these chloride channels. Barbiturates in higher doses also increases directly chloride ion conductance, which leads to hyperpolarization and decrease in membrane excitability. The difference between barbiturates and benzodiazepine is benzodiazepine increases frequency of opening frequency of opening of chloride channels, whereas barbiturate increases duration of opening of chloride ion channels. Now come to therapeutic uses of benzodiazepines. First use is insomnia. So what is insomnia? Insomnia is said to be present if a person complains of difficulty in falling asleep or stay asleep, or frequent nighttime awakening, or disturbed sleep by nightmares, or sleep which does not refresh. Initially, insomnia is managed by non-pharmacological measures, which includes number one, increased daytime physical activity, which increases stage 4 NREM sleep. Number two, avoid daytime naps. Number three, keep the room temperature on cooler side. Number four, avoid sleep distractors like mobile phone, computer, caffeine, and teas. This drink should be avoided on evening hours. Number 5. Go to bed only when feeling sleepy. Do not use bed for eating, reading, or for watching television. If all these non-pharmacological measures fail, we start drug therapy. Insomnia is divided into three categories. Number 1, transient insomnia. Number 2, short-term insomnia. And number 3 is long-term insomnia. Transient insomnia lasts for about less than 7 days. The reason of transient insomnia is unusual pattern of work, like overnight train journey, like shift worker, or when you visit new places. For the treatment of transient insomnia, mostly we use short-acting benzodiazepines like triazolam and temazepam. These drugs should be administered intermittently, like on the alternate day or thrice weekly. Second is short-term insomnia. Short-term insomnia lasts for about 1 to 3 weeks. The reason of short-term insomnia can be personal stressful situations like job problem, intense sorrow, or grief. For treatment of short-term insomnia, intermittent-acting or short-acting benzodiazepines are used, like temazepam and flurazepam. Next is long-term insomnia. Long-term insomnia is said when it lasts for about more than 3 weeks. The reason of long-term insomnia can be underlying disease or personality changes. For the treatment of long-term insomnia, long-acting or intermediate-acting benzodiazepines are used, like flurazepam and nitrazepam. These drugs can be administered alternatively or thrice weekly for the treatment of insomnia. Now come to other indications of benzodiazepines, like anxiety disorders. For the treatment of anxiety disorders, diazepam, lorazepam, and oxazepam is used. Alprazolam is a benzodiazepine which has anxiolytic as well as antidepressant property. Therefore, it is used for the treatment of anxiety associated with depression. These benzodiazepines also used for the treatment of panic disorder. Next indication is for the treatment of epilepsy. Diazepam and lorazepam is used for the treatment of status epilepticus. Clonazepam is used for the treatment of petit mal epilepsy. Diazepam is also used for the treatment of febrile convulsions, especially in the children. Next indication is for the induction of anesthesia. For the induction of anesthesia, short-acting benzodiazepines, midazolam is used because it has rapid onset and short duration of action. It is also used for short surgical and diagnostic procedure. Next indication is for the treatment of anticipatory vomiting. For the treatment of anticipatory vomiting, diazepam and lorazepam can be used because these drug produces amnesia. Next indication is as these drugs can be used as pre-anesthetic medication, and these benzodiazepines are also used as mild-relaxant because it has mild-relaxant effect. These drugs are used for the treatment of upper motor neuron disorder, tetanus, before orthopedic manipulation, and for the treatment of strychnine poisoning. Now come to therapeutic uses of barbiturates. Barbiturates are used, number one, for induction of anesthesia. Ultra short acting barbiturate thiopentone is used for the induction of anesthesia. It produces loss of consciousness within 10 to 15 seconds and recovery occur within 10 to 15 minutes. Barbiturates are also used for the treatment of epilepsy. Barbiturates are used for the treatment of tonic-clonic seizure and partial seizure. This next indication is narcoanalysis. Barbiturates like pentobarbital and amobarbital is used for narcoanalysis to make person more communicative and amenable to suggestions. Next indication of barbiturate is for the treatment of hyperbilirubinemia in neonate. Barbiturates are enzyme inducers. They increases glucuronide. They causes induction of glucuronide conjugase enzyme. Bilirubin get conjugated faster and rapidly annulled.